Hi, this is Dr. Heise. I'm your medical director here, and I was asked to go ahead and kind of give you an update on where we are with COVID. First off, let's go ahead and talk about the infection rates and things like that. Obviously, Omicron has been spreading wildly around the countryside. We've had over 1 million a day reported, obviously some of the highest numbers we've ever seen. What you have to remember is that with viruses, they typically will mutate, and they want to mutate so that they can go ahead and spread to more people. When we hear people say that the virus is getting smarter, viruses don't have a brain; they don't get smarter. It basically gets inside of a cell in your body and it replicates, makes a copy, hopefully an exact copy, and basically that's how it propagates. Sometimes we make mistakes; we call them mutations, and sometimes that mutation gives it an advantage. Now, if something made a COVID virus so lethal that it killed everyone it touched, it basically would kill a bunch of people all of a sudden, and then it would stop because basically there would be no one left to go ahead and spread it around anymore. In the case of Omicron, what you have to think about is it's making it very contagious and it's spreading, but if you notice, not many people are being hospitalized for it. We have a lot of people in the hospital that are being diagnosed with COVID, but a lot of that is incidental findings. For an example, if you had a car accident and went into the hospital and they check your COVID status and lo and behold, you're COVID positive, but have had no symptoms, you are still a COVID admission. So in thinking in terms of that, the number of people that are sick enough to warrant hospitalization is actually quite low. When we talk about children, again, the numbers are very, very, very low. Much more of a chance of your child getting influenza and getting sick enough to require hospitalization than there is with COVID. You have to remember the coronavirus or COVID is basically the same thing as a common cold. It just has different spikes on it. But as far as how it transmits, etc., it's very much like the common cold. And with Omicron, a lot of the symptoms, again, are very much like a common cold. So some of the things that we need to talk about are getting your booster. And there's two trains of thoughts on that. One is if I got the 2 Pfizer shots, should I get the booster as a Pfizer shot or should I go with a different one? What you have to remember is when you got the first Pfizer shots, you developed one type of antibody. Now, if you got the same booster and it was with the Pfizer one, you're just going to make more of those antibodies, and there's certainly nothing wrong with that. On the other hand, there are some people who say, well, what if I got the Moderna? If I had the 2 Pfizers as my primary vaccine, can I get the Moderna as a booster? Well, that would give you a different type of antibody. So now you have 2 different ways that you can go ahead and attack it. So there's no right or wrong way here. And then if we go further and we say, what if I get it naturally? Well, then you have a multitude of antibodies that will be developed, and you'll have those floating around. So again, the more antibodies you have and the more variety you have, the more chance that you're going to be able to handle these mutations as they come along. As far as wear a mask, I'm the only one in this room right now, and I'm sitting here all alone just chatting with you. And so obviously I do not have my N95 mask on, but I do have it right here, and I wear it whenever I am around anybody I'm working with. As far as social distancing, we still need to remember to keep our social distancing rules in effect. Also, with respect to being sick, if you're sick, don't come into work sick and then ask to get tested. That's probably not the right way to do it. Call your doctor, find out where you can get tested locally, and get tested and find out if you're negative or positive. If you're positive, obviously you need to stay home. If you're negative, then you're certainly okay to go ahead and come on into work. So I hope that this has given you some nice information to go ahead and deal with, and I will be updating you further in the future as data comes in. Thank you.